Hey, what's up guys? My name is John and I'm an emergency medicine physician assistant. And in today's video, I'm gonna be sharing with you guys 8 per diem moonlighting PA salaries. 8, because you know your boy John won't let you guys down. Moonlighting or working per diem essentially is picking up a second job outside of your primary employment. So in this video, I'm gonna explain what is working per diem or moonlighting as a PA, those incredible PA moonlighting salaries. And then lastly, I'm gonna share some caveats behind those salaries. And please guys, before we get started, just take a millisecond and hit that like button down below. It really helps our channel out so much, really helps us get seen by more people on YouTube. All right, so let's get started. So in general, moonlighting, or how I like to say it, working per diem literally means by the day in Latin, that you are working a second job. You're going to a job to pick up an extra shift or two here or there. While we use the term moonlighting, you don't necessarily have to work at night. Moonlighting or working per diem shouldn't be confused with something known as locums tenens, which is more or less travel medicine. So you can work as a nurse or a physician assistant or even a doctor and travel to different facilities and locations around the world and pick up various contracts spanning anywhere from a couple weeks to several months at a time. For the purpose of today's video, I'm not talking about travel medicine, but we can share that in a different video. In a recent forum, a few PAs shared and commented on how much money they're making moonlighting or working per diem. One PA near New York City had a critical care job and they were earning $80 an hour with a bonus. And they claimed that they earned $50,000 last year as a 1099 contractor. There was another PA who committed to 2 shifts in the emergency department, earning $100 an hour as a W-2 employee, which came out to $25,000 extra that year. One PA shared that they were working in urgent care for $70 an hour, just 2 Saturdays per month. For commitment of 2 to 4 shifts a month, there's a PA working in hospital medicine making $90 an hour. A psych PA said that they would moonlight during the weekends. They would earn anywhere from $600 to $1,400 every weekend. One trauma PA work per diem said that they were making $65 an hour, which resulted to an additional $12,000 to $18,000 a year that they were earning on top of their regular job. Lastly, we have a PA in California making $130 an hour per diem, and another person claimed that they were making $150 an hour. However, I'm not sure where they were or what specialty they were in. In general, moonlighting is going to pay you an additional $5 to $15 above your normal hourly PA salary. However, it could also pay time and a half over your regular PA salary. So I know that some of you guys are hearing these per diem moonlighting salaries and just salivating right now. There are a few caveats to moonlighting as a physician assistant. First and foremost, a lot of per diem or moonlighting gigs don't really have a long, intensive training period attached to it. They kind of expect you to be up to speed in regards to the medicine. So that means these jobs usually aren't very appealing for a new grad PA looking to pay their student loans very quickly. The next issue about per diem gigs is that they will usually always have a minimum commitment required of you. Most job listings that I've seen will usually ask you to do anywhere from 2 to 4 or even possibly 6 shifts a month. They may ask you to commit to weekends where traditionally they have staffing issues. They may also ask you to work night shifts. It can impact things like your social life, your family life, and relationships. So there should be a balance, right? This could possibly lead to burnout between your regular job and your per diem gig, especially in a specialty like urgent care, where as a per diem urgent care provider, you will probably be seeing 30, 40, maybe even 50 patients a day at some locations. A lot of these per diem gigs, unless they're in the middle of nowhere, you're usually fairly active at work. The lack of benefits. So a lot of the per diem jobs will give you malpractice. However, some of them will try to even skirt that. Whether you are a 1099 employee or a W-2 employee makes a big difference, because if you are a W-2 employee, you effectively only have to pay 1/2 of the payroll taxes. A lower priority. Some jobs will prioritize their per diem people, but a lot of jobs will actually fill in the full-time people and then kind of have you working the more inconvenient shifts, whether that means weekends, nights, or holidays. Those are usually when they want to use per diem people to kind of fill in the gaps in the schedule. So I don't want to be a downer. I'm going to talk about some of the pros of working per diem, which is obviously additional money. Secondly is the ability to see a profession outside of what you typically do every day. Maybe you go get a per diem wound care gig, dermatology gig, critical care gig, or something like that, where now you're learning and being immersed in a different aspect of medicine, and that might actually help you in your everyday regular job. Lastly, having a per diem gig is a good safety net. If anything happens to your regular main job and you have a good rapport with your per diem job, you might have a full-time position lined up for you, ready and waiting. So guys, get out there, go get that dough, and go learn a different aspect of medicine, moonlighting or working per diem for another job. Guys, that's all for today's video. If you have any questions or comments, leave them down below. I'd love to hear from you guys. If you enjoyed the video, don't forget to hit that like button and consider subscribing to my channel. I'm releasing more pre-PA and PA related content. Follow me on Instagram for more of the life of a PA. And guys, stay safe out there. Have a great rest of your day. Bye-bye.